Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. Studies suggest that the management of stress, burnout, various mental health problems like depression and anxiety, and addiction problems require more than just treatment with pharmaceutical medications. In 1984, two top psychotherapy researchers, Prochaska and Di Clemente, published data to show the 10 core processes that are related to therapeutic change in addiction behavior. But many of them also apply to stress, burnout, mental health management as well. So their approach, known as the trans-theoretical model of change, has become a foundation for counseling and peer support within the psychotherapy world. So I want to briefly outline the 10 core processes for you to help you appreciate their importance in the comprehensive management of addiction and mental health problems. So the first core process is known as consciousness raising. This means increasing the patient's awareness of their behavior and its consequences on their own mental state and their functional state and the impact it's having on others who are close to them. The second core process is self-liberating. That means freeing the patient from victimhood, helping the patient realize that they have other choices they can be making and that they're not passive victims of their mental health or their substance abuse problem. The third core process is social liberation. This means helping the patient establish a social environment that offers opportunities for the patient to get their needs through non-destructive means. So this may mean helping them create a more positive social circle, offering them peer support from a person who's already gone through a similar experience and came out the other side creating a productive life for themselves, and showing them how to access other positive resources in their vicinity. The fourth process is known as counter-conditioning. This means unlearning the destructive behavior that has become sort of an automatic trigger when certain events occur. So for substance abuse, it means replacing drugs or alcohol with maybe exercise or a positive hobby or meaningful activities where they're helping others. For mental health patients, it means replacing symptomatic behavior with more socially appropriate behavior. It's understanding the gap between stimulus and response and catching yourself in the moment when you feel triggered to do something destructive, but instead you make a more positive choice in your behavior or your response. Number 5 is stimulus control. This means teaching the patient to avoid emotional states or situations that tend to trigger undesirable behaviors. It might involve avoiding certain friends or staying away from certain situations or environments, and avoiding stimuli that threaten one's emotional control. The sixth process is known as self-reevaluation. Now this means helping the patient discover and appreciate their strengths and weaknesses in light of new insights about themselves. The idea is to help them see that they are not their drug addiction, they are not their mental health challenge. They have many other positive aspects and talents that should be recognized and nurtured. Number 7 is environmental reevaluation. Now this means helping the patient recognize how their behavior affects the well-being of others and helping them realize that whatever social rejection they may have experienced in the past is not because people don't like them, but because their actions and behaviors really caused the problem, which can be changed to engender more positive relationships with friends, family, and co-workers. The 9th core process is called contingency management. This means changing the consequences of the behavior. In many cases, the patient with an addiction or mental health challenge was excused for their unacceptable public behavior when holding them accountable would make such behavior less rewarding and less reinforcing. Number 9 is dramatic relief. Now this entails an opportunity for the patient to fully verbalize all frustrations with life that they've endured so far, allowing full ventilation of their emotions. This often is a cathartic moment which resets the clock for change to begin. Now dramatic relief should occur early in the psychotherapy sessions when the patient can no longer mask their pent-up feelings and emotions with drugs, alcohol, or other avoidance tactics or destructive emotions or behaviors. And the 10th core process is helping relationships. This means the therapeutic bond between the patient and the therapist, who now provides one-on-one support and encouragement for the patient's efforts towards positive change. They may not do it perfectly, but they know there's someone there supporting them and helping nurture it along. And the sense of being understood and accepted is particularly meaningful to help patients with both addiction and mental health problems. Now, in addition to these 10 core processes, a highly skilled psychotherapist can also zero in which of the 5 levels of intervention are most important in the patient's case. So the 5 levels of intervention that they need to identify which of these is most important, or possibly a combination, would be symptoms or situational, which deals with is it the immediate stimuli that's triggering the behavior? Is that the major thing that's causing all the problems and the consequences? Or is it maladaptive cognition, focusing on correcting the dysfunctional thought the patient has, the sort of recurring pattern of thought that leads to symptomatic behavior, changing the thought process? Or is it number 3, interpersonal problems, between individuals, which address difficulties the patient has in dealing with the world outside their intimate circle? This can be due to lack of social skills, lack of coping skills, or lack of acceptance on the part of larger society. Number 4 would be family conflicts, which relates to dysfunction within the intimate circle of family and friends, which often triggers and feeds the symptomatic behavior. Or is the level of intervention applied at the intrapersonal level of conflict, which deals with pain from deep-rooted psychological problems from early life experiences and reinforced by continuing maladaptive affective responses? So, in summary, the trans-theoretical model deals with where the patient is, which level of intervention is most suited to their circumstances, and the elements that are necessary to bring about meaningful change. Now, after considering all of this, you probably agree with me that this type of targeted psychotherapy, which considers the whole person, should be a foundational aspect of the comprehensive management of addictions and various mental health challenges, as it complements and is likely to enhance the pharmaceutical treatment used to treat many of these problems. So I've included the reference for this information in the text below. Thanks for watching. I will see you next time.